I'm Dr. Sandeep Prabhakar Burke. I'm a consulting nephrologist at Mumbai. Greetings. Today we are going to discuss about the seriousness of kidney disease in India. A peculiar case study has been found in the Uddanam district, which is in Andhra Pradesh bordering Orissa. Here they did a screening study of around the population of around 25,000 people in around 70 villages, and they found that around 20 to 25% of the population is having CKD, chronic kidney disease, including stones and small kidneys. So if we correlate this to around the 1.4 billion population of India, where we are having around 10% of the population which is having the kidney diseases, then around 200 million people are having kidney disease which may be asymptomatic without symptoms or problems to the body. This is a huge number, a number which is more than the entire population of most countries in the world. Finally, we are the stone belt of the world. India and Pakistan have the maximum patients with kidney stones. So, the management and treatment of kidney stones may not be to that much extent, and many people just forget about it and just keep on drinking water without doing even a sonography. That is why the internal damage continues and kidney disease may increase. We are also the diabetes capital of the world. We have such a large population and many of the patients are non-compliant. They take half medicines, they refuse insulin, they do not have a dietitian access, and they take food on and off type of way. So that is why we are having diabetes which is moderately controlled, not fully controlled, and that damages the kidneys also, including the heart and the brain and the blood vessels, etc. We are also having patients who are uncontrolled completely, refusing to take any treatment. These patients do also go into the kidney failure, proteinuria, then rise in creatinine and onto dialysis, and may later on go on to kidney transplant. We are also the metabolic syndrome capital of the world. Indians have a unique ability, as I would say, that they have diabetes, hypertension, high cholesterol and obesity, all of that together. And all of this together will damage the kidneys also, and that is called as target organ damage, end organ damage. Now these all being silent diseases, the person themselves do not know whether they are having the disease or not. And even if they know they are having the disease, they do not know the severity of the disease, whether it is less or it is a very severe disease with high levels of the problem. So that is why the screening of the population helps us to pick up the persons who are having the disease, and later on treatment as required is useful for these people. So these all factors have finally got us an astounding number of patients with kidney disease, and that is why the healthcare sector has to focus on preventive measures so that the diabetes is controlled, blood pressure is controlled, the obesity is controlled, and the kidney stone is managed as early as possible, and then the kidney disease incidence in the entire population slowly decreases and it becomes to a manageable level, and very few patients go on to dialysis and kidney transplantation. World Kidney Day 2025. It is a joint initiative of the International Society of Nephrology and the International Federation of Kidney Federations. This is a common effort by all kidney associated medical, paramedical and government related personnel to see to it that kidney health and kidney disease awareness spreads all over the world, in all countries, in all economic strata. So whenever we are talking about World Kidney Day, it happens on the second Thursday of March every year. This year the date is 13th of March 2025. It is going to be a year-long celebration actually, but the main day is 13th March 2025. We are having instructions from the World Kidney Day organization to how to go about planning and executing the World Kidney Day celebrations. There is a social media toolkit which gives us precise various aspects of it, including posters, banners, props, how to go about coordinating with various hospitals, government agencies and NGOs, non-government agencies. This campaign this year is focusing on prevention and awareness. Are your kidneys okay? That is the theme slogan for this year's campaign. As per the Indian Society of Nephrology, there are approximately 2,000 nephrologists for the entire Indian population of 1.3 billion people. So if we consider 10% of the population, millions of people all over the world in the rural area also have kidney diseases. Now these people will first go to the primary healthcare center or the general practitioner in the village, and then they would be referred to the district health hospital from there to the tertiary care center in the main cities, including the private hospitals. Now, these people, when they are referred, it is not possible for the super specialist nephrologist to sit in the villages with the population of just 500 people or 1,000 people, because that would be underutilization of the resources of the super specialist doctor. And if there is a public hospital giving dialysis to the poor patients, then it may be around 10,000 or 6,000 of rupees of India per month as dialysis cost. And a transplant may happen for around 3 lakhs of rupees, that is 0.3 million rupees of India, in the public hospitals of the major cities of India. They are of course subsidized again by various schemes by the government. This would be the Rajiv Gandhi Yojana or the Mahatma Jyotiba Phule Yojana, which is present in Maharashtra and in India, and the Ayushman Bharat Yojana, which is present all over India currently, and by the help from various NGOs, non-government organizations. And this includes religious organizations also, from Mandir, that is Hindu Mandir Trust, Muslim Trust, and Jain Trust. And this give checks in the name of the hospital and with a letter to the hospital for which patient it is to be used for. And they are dedicated kidney trusts also, which give solely as a help to the patients who are having kidney problems. There is one more aspect about kidney health. Whenever there is a patient of kidney problems, suppose he is on dialysis or he is a transplant patient, then from the village he goes into the tertiary care center in the city, but then he has to be accompanied by his main family members and a few helping hands. That comes to around 3 to 4 people accompanying the person to the tertiary care center in the city. Now this causes a big problem to the family of the poor patient, because they are the laborer people or they are the daily wage laborers, and when they all leave their work and sit in the city, it is not possible for giving even free care to the patient. That is why a social security net helped by the social worker of the various hospitals is very much required for these patients. They may require lodging, boarding, food at that moment for the relatives themselves, because they themselves have lost their job and are not doing their job and are sitting in the city with the patient. Also, the transportation of these poor patients and relatives batch from the village to the main city, which may be around 100 or 200 kilometers away, is something which is also very important for these people. Even if it is the subsidized state transport, this finally costs money and takes a lot of time for these people. That is why the government of India is coming up with the telemedicine aspect. In the telemedicine aspect, we are seeing that the patient is consulted by the super specialist doctor, and the intermediary general practitioner or the physician is the one who takes over charge of the patient, and whatever is required is done for the patient as is necessary. The telemedicine aspect is very important for these patients because the need to travel for a longer distance is not there, and also it is on demand, that whenever the person is having time to talk to the doctor, that time itself the doctor can be accessible to the patient. Sometimes the person may not be able to reach the doctor in the OPD timings. That is why telemedicine is a lifesaver for these patients. Importance of early detection. This has been emphasized by the World Kidney Day 2025 program. Are your kidneys okay? This helps us to spread the awareness and also to find out cases which are silent in the community and the population. So, if you are having a chronic kidney disease or a kidney stone which is silent, and if it is picked up, then you will be treated earlier and you may later on have lesser complications like need for dialysis and transplant later on in life. So this is why a better comprehensive program, which is including the awareness about the situation of the kidney diseases and a screening program to find out the diseases who are not suffering from the disease, who are asymptomatic, is much more important than later on treating them with expensive treatment like dialysis and transplant. So if you are finding this video knowledgeable, kindly like, comment and subscribe to my channel. 3. Branded medicines are available everywhere. Generic medicines are available at lesser number of shops, including the Jan Aushadhi Yojana shops. But then the acceptance of these medicines by the general population is still lacking. This is because of the misconceptions of the general population and also the healthcare workers like doctors, who feel that the generic medicines are of lower quality because they are cheap. That is not true. Actually, the active pharmaceutical ingredient API in both of these branded and generic medicine is the same, and it is provided to all over the various chemists in the country. That is why the awareness programs needs to be done by the government of India that the generic medicine is exactly the same as per the branded medicines, and it goes through quality control and checks. This will help the general population to accept the branded medicines and the generic medicines at par, so that the quality is good, is known to everybody in India. The road ahead. Given that India's population of around 60 to 70% is in the villages, a rural population, the focus of the healthcare of government of India should be on the villages. So coming to the most basic level, first and foremost is proper sanitation and a good clean water supply. Then comes the proper nutrition of the general population with the emphasis on the protein intake and the vitamin intake of the general population. Thereafter, we come to the next step, that is the availability of the healthcare system. The primary healthcare centers are available in every village, but having better staff and better availability of medicines, including the generic medicines, is of utmost importance. We come to the next point, that would be the emphasizing on the improvement in the healthcare service sector. That would be the telemedicine concept, in which the primary healthcare sector doctor will speak to the super specialist in the city and find out various consequences of the reports which have been done by the patient, and will help in treating the patient to a better extent. A coming up concept is the AI driven health tracking systems, which will be used in the rural areas, so that there is an integration of the information between the villages and the cities, between the primary healthcare center and the super specialty hospitals. This will help in promoting the various government initiatives of healthcare awareness and treatment for the rural population. Finally, it is a big opportunity for the government of India and the people at large that whenever we have more technology coming into the healthcare industry, it will help in spreading the awareness and also penetration of the medicines and the treatment to the general population to make a healthier India. If you are finding this video knowledgeable, these are the other videos which will be useful for you.